We are going, there it is. We are going to record this meeting so that those who couldn't make it, we acknowledge it's summertime and a busy time. All right, we're going to go ahead and excuse me, kick off here. So good morning, everyone. Just quickly want to tell you a few things. The chat is open for ideas and conversation. We're going to, one of the reasons we're recording this is so we can capture the chat. What I'm going to do is I'm going to provide, my name is Meg Zalatel. I am the Executive Director of the Anchorage Coalition to End Homelessness, which is the COC lead agency. So I'm going to make some remarks. I'm going to turn it over to our Advisory Council Chair, Jessica Parks. We're going to have an update from Catholic Social Services about complex care. And then what we hope to do is to turn it over for conversation because we don't often get the chance to be in a space, even a virtual one, to have conversation. So that's the quick lay of the land for this morning. And I just really want to thank you all for being here. I am going to be, I'll just be very transparent. I'm going to be working from some notes. And so while I'm speaking, I won't be able to see you all while I am working from my notes, but I do look forward to having the conversation after all of our speakers. So first, again, thank you for joining us. We wanted to convene an all COC meeting as we enter the last week before the closure of the Sullivan Arena. I know this is a busy time for all of you, so let me begin by saying thank you. You've all faced the challenges of COVID, and now we're facing new challenges with the closure of mass care operations. I acknowledge you are stretched thin personally and organizationally, and yet continue to show up and help those experiencing homelessness again and again. Thank you. Also, before I turn to the challenges, let's take a moment again to celebrate the successes. First, the homeless prevention response system seems united and collaborating in real time, particularly around the system capacity map and priorities. We're thankful for continued partnership and excited to work with you all in finding creative paths forward. Additionally, housing continues. Over 320 people have been housed since July 2021. That's an average of over 26 individuals each month. And if you look at the data, you'll see that that is actually gaining momentum and increasing. And it doesn't include those individuals that are now in transitional housing opportunities through the housing stability funds. Also, a little later, you'll learn more about when referrals to the new complex care shelter will start, another overdue capacity expansion that's been needed in the HPRS that is meeting the needs of some of our most vulnerable community members. So I think it's really important in these challenging times to always take a minute and start by reviewing the successes because they often get lost in those challenges. Now, the HPRS is seeing significant challenges, especially since June 1st, when the Sullivan Arena stopped taking new clients, as well as the clients who are uncertain, that uncertainty of where they'll go when that facility closes. As a result of some of that uncertainty and the lack of new intakes, we've seen an increase in people experiencing unsheltered homelessness. This is and continues to be extremely challenging for several reasons. Continued hot weather and high fire danger present complicating factors around ensuring people have access to food, water, and their hygiene needs. Outreach is already stretched thin, and increased unsheltered individuals, and now camps are being, because there's an increase in unsheltered individuals, and now camps are being noticed for abatement with no identified shelter capacity, despite numerous attempts from many to get that information from the municipality. Just this month, on the 14th, 42 camps were noticed for abatement. We still don't have the identified identified shelter capacity of where outreach can suggest those individuals could seek shelter. And just yesterday, an additional 5 camps were noticed for abatement. Again, we do not know where the shelter capacity is, and it is very challenging to conduct effective outreach when we don't know where to tell people to go. As we look at the system capacity map that's being updated regularly by the participation of all of you, we're just not seeing the capacity in the system to either provide shelter or housing to these unsheltered individuals in the time that camps are noticed for abatement. Sadly, we've had at least one suspicious death of an individual experiencing homelessness. It's very tragic and very sad. And I know that for a lot of you and for us, that adds an additional heaviness to a very challenging time, because we are all so focused on trying to provide safety to our community and those who are experiencing homelessness. Additionally, we have families experiencing unsheltered homelessness for the first time in many years. This is a new challenge. It's a challenge that doesn't necessarily have resources assigned to it. Our outreach teams have typically focused on unsheltered single adult homelessness. And so we don't have dedicated resources to provide this outreach to families. That said, I know many of you are rising to the challenge to try to meet the needs, but again, we don't have identified resources available to send families to on a regular basis. Turning specifically to the closure of the Sullivan Arena, we have some concerns. We're hearing that on the 30th, that the Anchorage Police Department will be asked to come and assist with the closure of that facility. The engagement of law enforcement in that closure presents, we think, some challenges. We believe this will be a very traumatic experience for those who will be asked to leave the facility. And in anticipation of that closure and these challenges and this information, we've made some urgent requests to the municipality. First and foremost is, if the police department is going to be engaged in that closure, excuse me, that the crisis intervention team trained officers and the mobile crisis team be there to support those who are being asked to leave the facility. Those individuals, we believe, are more trained and well equipped to engage with individuals who may be quite distressed at losing their shelter. Additionally, we have asked that individuals who are being asked to leave the Sullivan Arena get access to some basic necessities right away. And those are transportation, so they have transportation wherever they need to go, meal vouchers, hygiene kits, including masks and rapid test kits, along with other essential items, especially hot weather items, be provided during the closure of the Sullivan. We have consulted with our HUD disaster TA, and these 2 recommendations came directly from the HUD disaster TA. What we know is that when a facility is closed and we have the engagement of law enforcement, we can actually exacerbate a situation. And it's really important that we acknowledge the reality of the situation, which is, of course, people experiencing homelessness are humans first. Individuals encountered on the street or in a camp are someone's son, daughter, brother, cousin, former colleague, former neighbor. Just for you all, I know you already do this, but I think it's a good reminder. Imagine someone closest to you becoming or experiencing homelessness and living, unsheltered. Housing is a basic human right, and homelessness is solvable. And we believe that law enforcement and the justice system can help be a part of the solution if engaged in an appropriate manner. We also need to acknowledge that there are significant equity issues in homelessness, particularly that most of those who are experiencing homelessness in our homeless prevention and response system really reflect that there are racial disparities in access to services and impacts. We really want to focus on this, during this challenging time in ways that we can strengthen the safety net for people experiencing unsheltered homelessness. And we believe there are several paths towards this. We hope that there's the opportunity to work with the municipality to decriminalize homelessness and coordinate outreach and engagement efforts using a true housing first model, where we can bring services to those who are in encampments without fear of that encampment being moved in a arbitrary time, whether it's a 10-day notice. We do acknowledge that there are some instances where camps should be noticed for health and safety issues, but if we can work collaboratively with open communication, we think we can better utilize the resources to meet the needs of those who are experiencing unsheltered homelessness and really practice that housing first approach. I know that the outreach coordination through the Anchorage Coalition to End Homelessness with our outreach partners is very willing to engage in that work, but that work can't be done without additional resources towards outreach, such as transportation to get people to what they need, especially documents to view a unit, various appointments. And we need the opportunity and the stability to provide those services, much like we do in this sheltered environment. So at this time, I think it's really important that we rethink engagement around unsheltered homelessness and outreach so that we can be really putting our resources to the highest and best use, acknowledging that the outcomes for people experiencing homelessness will be better if we approach it from that housing first perspective versus one of abatement and displacement. So I'm going to shift gears a little bit. We have also learned recently of a new challenge that there's been notice about delays in getting the Human Services Community Matching Grants funding for fiscal year 23 out into the community, as well as communication from the health department that these grants will not be available for expenses incurred prior to the award of the grant. So this will create funding gaps and possible program reductions for many of the groups this year. It's critically important for programs that rely on this grant funding to receive it in a timely manner. As we learn more about these impacts, as an HPRS, we will need to strategize ways to meet the need to avoid program reductions, especially with no additional capacity to accept individuals who could be impacted. So more on that, I think if you are a COC member and you are impacted by this delay, please, collaborate with us, let us know so that we can put a united front together and really work together to minimize the impacts or advocate that there will not be impacts and that if there's a delay that the expenses can be billed retroactive to the start of the fiscal year. So in closing, I don't share these challenges to be discouraging, but to be transparent. With transparency, we can have an open and honest conversation about how we can leverage our resources and networks to meet these challenges. The HPRS cannot step in and meet all of these challenges alone. We need the partnership of our local government. Without that partnership, we can try to band-aid the most urgent needs, but that is all. Now I will turn it over to Jessica Parks, who is the Advisory Council Chair, to provide some updates, and then David Rittenberg from Catholic Social Services to discuss complex care referrals. After we hear from them, time permitting, we'll open it up for some discussion. We hope to do that, again, both via the chat, which we will capture, and in a moderated way in real time with Jessica and the coalition staff acknowledging those who wish to speak by raising their hands. Again, thank you for your time and your service to people experiencing homelessness. Jessica, I'll turn it over to you.
Thank you, Meg. And thank you everyone for joining today. For anyone who does not know me, my name is Jessica Parks. I am the Advisory Council Chair for the Advisory Council, which is the governing body for the Anchorage Continuum of Care. I also am the Housing Operations and Development Director at Rural CAP, which has housing operations and services here in Anchorage and across the state. I want to echo what Meg said about collaboration and teamwork. Coming together as service providers in the homeless prevention and response system has been how we've been able to address these challenges in the past, and how we will continue to be able to address these challenges moving forward. She mentioned the system map. I want to highlight just how important it is that we keep that information up to date. When we have parts moving so quickly, it's so important that we all have the most up-to-date information on where there is capacity and what type of eligibility restrictions might exist for different programs. If you're not currently receiving those emails with that information on it and requesting updates to that, please let us know and we'll make sure that you get added to that mailing list. But the system map is available on the Anchorage Coalition to End Homelessness website, ach.org, and it's being updated every 2 to 3 days. I also want to call attention to a resource that exists for us, and that is our monthly advisory council meetings. They're held on the 4th Thursday of every month from 4 o'clock to 5 o'clock in the afternoon. If you're not able to attend every month, the meetings are recorded, and all of the recordings and meeting materials for any prior meetings are available on the website for you to get to as well. The Advisory Council has formed 4 committees. The Community Prioritization Committee, which focuses on the strategic plan for homelessness for the Anchorage area and ways that we can work together on that. The Coordinated Entry Committee, which focuses on the coordinated entry system. The Data Committee, which does a lot of work with the HMIS data and other data that exists through our service partners, and what story that tells us about the state of homelessness in Anchorage and statewide. And then last, our Compliance Committee, which works with the coalition as the lead agency on all of our COC NOFA work, as well as compliance overall for the continuum of care. If you are not a member and are interested in becoming a member, there is a membership form on the coalition website that you can fill out and be added to all of this information. I'd also like to highlight that right now we are accepting applications to become an advisory council member. You can find those applications on the website as well, or you can reach out via email or put in the chat if you would like a copy emailed to you. And last, I want to call attention to a new notice of funding opportunity that was just released by HUD yesterday. This is a new NOFO that is going to be focused on funding homeless outreach, permanent housing, supportive services, and other costs as part of a comprehensive community approach to solve unsheltered homelessness. And this is also going to include a set aside specifically for rural communities. This will be a continuum of care program. So it will be worked through the NOFO process that people who are current COC grantees are familiar with. So stay tuned for more information on the timeline for that application process, as well as the steps involved. As Meg said, there'll be hopefully some time for questions at the end of the meeting, but for now, I wanted to turn it over to David to talk about complex care.
Hi, everyone, and thank you for having me today. For those of you who may not know me, my name is David Rittenberg. I'm the Senior Director of Adult Homeless Services at Catholic Social Services. And again, happy to be here today. Many of you may have heard, but for those of you who haven't, we have a new program that is added to our continuum of care, which is very exciting. And I just wanted to take a quick minute to sort of talk about a little bit about how we got here. This goes back to the start of our healthcare and homelessness partnership back in 2017 that set Brother Francis Shelter up to move into a role of serving people that have complex medical needs or had access challenges to where they would not do well at the Sullivan Arena just due to the fact that it is a hockey rink. And so at the beginning of COVID, Brother Francis Shelter moved into that role of serving those individuals at Brother Francis. As part of the process to stand down mass care and to build a more robust homelessness response system, we worked with multiple other partners to open up a purpose-built shelter that would serve a similar population that we were serving at BFS. The difference being, if anyone remembers back to March of 2020 and how we were all just sort of adjusting as quickly as we can, and we just made, adjusted our programs, quickly. We had more time to be intentional about how we built this program. And so it opened on June 6th. We moved the individuals that were staying at BFS over to complex care, closed BFS for a week to put up a coat of paint on the inside, do some deep cleaning, rearrange the floor plan, and just do some deferred maintenance that's difficult, dangerous, or disruptive to do while the building is full of people. And reopened BFS as low barrier emergency shelter on June 13th. Complex care, we initially opened to the first and second floor for the individuals that were staying at BFS, and those first and second floor make up 46 beds. And then we will be opening up the third floor on July 5th to add another 37 beds, which is going to bring us to 83 beds total. It is located at 303 West Fireweed Lane, the former Sockeye Inn, and it is going to be geared towards, as I said, people that have complex medical conditions or access challenges, and will be equipped with case managers that will have a specialized expertise in getting people connected to the services that are going to be most appropriate for them. And so, having case managers that are specially trained in SOAR and have, good literacy about Medicare and Medicaid and general relief and, all those other types of services that are going to be most important for, the type of individual that we are seeking to serve there. It will also be a referral-based shelter, which is what I'm really here to talk about today. It is not going to be a walk-up emergency shelter, but we plan to take referrals from other providers that have direct contact with people experiencing homelessness. So other shelter providers, outreach teams. I'm sure there are some other organizations that would be great referrers that I may not even be thinking of. And so that's one of the reasons why we wanted to come to this group today, as well as healthcare partners such as hospital discharge departments. It is a little bit different than our medical respite program, which some of you may know about, that is at BFS, where medical respite is more geared towards serving someone that has an acute condition. I broke my ankle. I need a couple of weeks to rest and recuperate, and then I'm going to be able to sort of go back into whatever program or whatever situation I was I had come from. Whereas complex care is really going to be more for chronic issues where someone really needs to get connected with long-term health care, get connected with a healthcare home, and ultimately get connected with a more permanent situation. So we do have the ability to serve people with more complex medical needs. However, you know, we do want to be pretty clear that it is not an assisted living facility. So individuals still need to largely be able to complete their own activities of daily living. Our staff do have a little bit of a higher level of training than than say our BFS staff currently, to where if someone were to fall out of a wheelchair or roll out of their bed or something like that, staff are trained to be able to assist them safely so they can get back into their bed or the wheelchair, or help them stand up or whatever that might be. But it is not a full-on assisted living or PCA type training. So, I also want to recognize that we are taking a bold step into something that is new for this community. And what the program that we opened up on June 6th, I'm sure that we're going to learn a lot in the next 6 months to a year to, throughout the life of the program. I would like to really depend on the COC to help give us feedback and help us, mold this program as it grows into the best program it can be to serve, the people that really need it. With that, I wanted to just quickly go over the referral form, just so you can sort of see it. We're not going to send it out today. We're going to send it out on July 5th, but wanted to go over the referral form so you can all see it, and then send out just a survey link for anyone who thinks that their organization would be a good source of referrals. So if you have direct contact with people experiencing homelessness, we'd ask you to fill that survey out with just a little bit of contact information. And then just a very basic question about, how do you interact with people experiencing homelessness, so we know who to send that referral link out to. We want to make this referral link available to organizations and individuals that do this work, but we also recognize that we really just can't make it open to the general public, because then I'm sure we'd just be getting referrals from every corner of Anchorage. And so we just want to be intentional about where we are receiving referrals from. So if possible, would it be possible for me to share my screen?
Yes, I'll set that up. And there's a question, are there age qualifications?
Yes, so no, we do not have age qualifications. We do anticipate that because of the individuals that we're seeking to serve, that our demographic is going to skew a little bit older, but there are not age qualifications. We've left the referral criteria pretty broad at this point, because as we're first starting out. And again, if we recognize a little bit farther down the road that we need to narrow that or make adjustments to that, we will, and we'll have a conversation with the COC to do that. But there is no minimum age other than 18. It is not geared towards youth, but individuals 18 years of age or older that are experiencing homelessness. So I do see that I was just made a host, and I am going to try to find the button to where I can share my screen, which is right there. Okay, so Got to ask everyone able to see my screen. I think that's what you do when after you share your screen, you have to ask everybody. So we have moved to a web-based form, which we will send this link out to partners that would like to make referrals. At the top, it's pretty basic with just some information about the referral form and some contact information for Jesse Taliba, who is the program director over at Complex Care. So if any of you have met Jesse in his role at BFS or as a case manager or case manager supervisor, he's a really good fit. Up top, just some information about what day it is it, who are you, who is making the referral, what agency is it coming from. This is going to be very important because we want to be able to close that communication loop within 12 to 24 hours from receiving the referral. So we need to know who should we get back to. If you are a shelter provider or an outreach worker or something along those lines, we want to have good contact information. So, if we're going to accept that referral, we would be able to get in touch with you and sort of close that loop so we can make sure to get that person in. Then the next section here is going to be information about the individual that we are seeking to refer. So this should look familiar to anybody that works in HMIS. It's the basic identification information from HMIS. And if we know their HMIS number, great. If not, that is not required. But then the best way to contact the person being referred. Do they have a phone number? Is email the best way to get in touch with them? Do we want to leave a note at the Brother Francis Shelter front desk, or they are always at the web between noon and 2 on Wednesdays? So we understand that there are often many creative ways where we may have to try and get in touch with the individual being referred. And so, if it's something like leaving a note or, calling an organization, or, they're always at the Tesoro on Tudor between, 3 and 5 on Thursdays, that type of stuff. So we left that pretty open-ended. And then if they do have a phone number, awesome. But we understand that oftentimes people do not. And then moving down, a little bit of information about their eligibility. So can they perform their activities of daily living? Like I said before, it is, we are equipped to serve people with complex medical needs, but we are not equipped to serve people that are unable to do their activities of daily living. Is this person agreeable to admission to the facility? That's just a fancy way of saying, do they want to go? Have we talked to them if they want to go, right? We can't force someone to go somewhere where they don't want to go. So we just want to make sure that they were given the option, yes or no, if they want to go to this facility. And then also, is this person currently experiencing homelessness? Where did they sleep last night? Again, some HUD information, and then if there's any more detailed information. So this where did they sleep last night is, you'll recognize these as just sort of the HMIS options, but then a little bit more detailed information that might help us find them. And then we have some prioritization and eligibility criteria. So if someone has high priority pre-existing medical conditions such as chronic lung disease, moderate to severe asthma, serious heart condition, a condition that causes them to be compromised, obesity, diabetes, kidney disease, dementia, or other neurological condition, or a liver disease. Do they meet any of the above conditions? Do they have a medical condition that puts them at risk for COVID-19? Do they have a mobility related issues where they're using a wheelchair, walker, cane, crutch? Do they have trouble getting around? That will help us determine what floor we're going to put them on, and also helps to prioritize. Are they currently pregnant? Do they have any mental health conditions? And then at the bottom, just a little bit of an open response section where you can tell us a little bit more about this individual, just so we know a little bit more as they're coming into the program. So, you know, this section I think is going to be really helpful. Just so, you know, so many of our individuals that we serve have unique situations that may not be fully captured in a checkbox or a radial button, or, you know, some sort of neat little survey information. So just having an open-ended section at the end to where you can just give us a little bit more information, then just verify that you're not a robot. And then the hope is that we will be able, or the not just the hope, but the expectation and intention is that we'll be able to get back to the referral source within 12 to 24 hours. So it'll be program managers that will be processing the referrals. We have 3, and so we'll almost always have a program manager on site, except when they have their days off. But every day there will be a program manager on site to be able to process referrals. So, you know, I think the biggest thing here on the referral form is making sure that we have good contact information. So if we do get that referral, we have someone we can get in touch with, whether that is the individual themselves or the referral source, you know, whatever organization you're a part of, you know, ideally both. But we just want to be able to respond back to the referral as quickly as we can, because as we know, you know, it's really important to be able to strike while the iron is hot, and while we have that person with us, you know, being able to get them moved over quickly. So then this is what I plan to send out today. Not that one. This one. Okay, so just a little bit. Can everyone see this? Complex care referrals. So this is just your basic survey, monkey survey. What organization are you from? Who will be the main contact for referrals? What's your email? What's your phone number? Where is the physical address that referrals will come from? So if transportation needs to be coordinated, like where is that? How do you interact with people experiencing homelessness? Are you a shelter? Are you an outreach team? Are you a medical provider? You know, whatever that might be. Do you have any transportation resources? This is, you know, CSS does have some transportation resources, but you know, if there are other resources that are available to help get someone over to complex care, knowing what those are, you know, is going to be helpful for us. And then just any other questions that you might have burning at this point. So I'm going to go ahead and drop this in the chat here, and then I will also, if it is okay with the ACEH team, provide this to them so they can send it out to their mailing list. We're going to collect this information, look over it, and then send out this survey, not the survey link, the intake form on July 5th. And we'll start receiving referrals on then to get that that 3rd floor all set up. So I'll go ahead and stop my share here and drop this in the chat.
Thanks, David. There's a couple of questions for you. So if you don't mind, I'll ask those while you're dropping that in the chat. One of the questions is, do all of the data points follow the current UDE options in HMIS?
Yes, that was intentional.
Okay, great. And then I see Nancy's comment, but I think that might be more generalized, although it does acknowledge that we really need complex care. So kudos, awesome. But we'll take that up, I think, in the more open discussion for a part of the conversation. Any other questions for David about complex care? All right. And I think you all know how to find Dave Rittenberg, but maybe he could drop his email just in case something comes up. And really excited about this as we move forward with this new resource.
If I may, I'm also going to drop in the complex care program director, Jesse. I'm going to put his email in the chat as well, because I will be going on PTO at the end of the day or halfway through the day tomorrow. And so will not be able to promptly respond to your questions if you do have any. And so I'm going to make sure that y'all have Jesse's email as well too.
Great. Thanks, Dave. Well-deserved PTO, I'm sure. Good timing for it. So, all right. I'm not seeing any other complex care-based questions. And we'll continue to talk about this asset and resource in the shelter leadership meetings and how we're engaging with it, making sure it's all working. You know, new things always take a little bit of time. And so just want to acknowledge that we'll continue to be working closely with Catholic Social Services and making sure the latest information gets out to you all. All right, so we're going to turn this over to more of an open discussion. We've talked about a lot of things today. And I know that you all bring such valuable insights and ideas to the table. So I really want to open that up for conversation. I think the best way to do that is if you have the ability to raise your hand, just so we don't have folks talking over each other. If for some reason you are in a position where your device isn't able to do that, what you could do is you could, if you've got access to the chat, then you could put that you would like to speak in the chat. And then if we have a lull, I can obviously invite anyone to unmute who doesn't have those capabilities. And to kick it off, I'm going to read out Nancy Burke's comments and we can have a conversation about this because I think it's a great way to kick off this discussion and move forward from there. She says, I'm wondering if there will be discussion about crisis comms, communications, and how to handle the hundreds of people who will be on the street in 7 days. So to provide some context, our best estimate right now for single adults who are experiencing unsheltered homelessness is 200. And we have the expectation that approximately 95 to 100 individuals will join them after the closure of the Solomon Arena. So that's the landscape. And the discussion about crisis comms, I will offer up that the coalition is definitely willing to convene some of those conversations, but we would need all of your voices. So with that, I'm going to be quiet and I would love to put that out for conversation or any other topic that people would like to talk about around the closure of mass care and kind of where we're at moving into, you know, these next 8 weeks or so. Yeah, an actual hand. Lincoln, I was watching for the emoji.
Sorry, I couldn't figure out how to do the emoji. Excuse me. I was just, I had just had a question about the past. I saw that there are some pretty critical articles in the ADN before, and I was wondering if you'd had any follow-up conversations with Emily Goody-Kuntz after those articles.
Could you be a little bit more specific about like which topic or exactly what you're referring to?
Specifically hers last Friday. I thought, you know, you guys did a great job with your Tuesday press conference and everything, but it felt like when I was reading that story that she'd taken what you'd said at the Tuesday press conference and maybe not followed up with you folks, or it didn't seem like she had taken into account the great updates that you are putting out on the actual shelter available. And I was wondering whether you'd talked with her to point out that those resources exist and are accurate and are gathered from the community partners.
Yeah, thanks for the question. Yes, and of course, we have no control over what follow-up the media may or may not do. You know, I think we're in that same position, though. Not much has changed, unfortunately, since the time of our updated, you know, our press conference update, or which would have been our update to the assembly. So I think it's really important that that's really why we held that meeting. Still there, you know, The system updates are great. They are something we publicize every time we do a system update. We push them out also on our socials. And we had been pushing them out via our listserv. That feels like it might be a little overwhelming. But if for some reason that's how you're getting them, that would be really good feedback for us to get, because we do want to make sure it's getting as widespread traction as possible. So I don't know if that
I do get them through the your listserv, and I find them useful.
Okay, great. Thanks for that feedback. I hope that answered your question. I was kind of like a yes, and we have no control over what the media.
No, obviously you have no
decides to
control
focus
over
on.
what she writes. I was just wondering if you'd followed up with her to point out that it seemed like maybe she left out important information.
Okay, yeah, thanks for that. Aurora.
Hi. Okay. So I texted some of my Covenant House folks to ask if I was the only person that didn't get the reference, but somebody in the chat earlier referred to the authorized camp working group as like a proper noun. And I don't actually know what that is. I don't know if that's a Muni thing or who that working group is through. And if they sent a memo around recommending that we start asking the faith community to open up, camping and services and stuff, I just don't know. I don't know who that is. And I was hoping somebody could tell us who that is.
Sure. Sid, did you want to address that based on your comments in the chat, or do you want Jessica to address how it might intersect with the advisory council this afternoon?
I can definitely address it. So the Homeless Prevention and Response System Advisory Council formed essentially an ad hoc committee, which had a focused work group effort on looking at the possibility of an authorized camp and doing some research into what that would take, what that would cost, what kind of resources, what risks were in there. And that group has put together a memo that will be presented at this afternoon's advisory council meeting and discussed and then voted on to see if that is something that the advisory council as a whole would like to recommend out. And this memo is specifically looking to see if the faith-based communities would be able to assist with that or have a part in an authorized camp.
I see Nancy Burke has her hand raised as well.
Can you hear me? Oh, great. I was having issues just a minute ago. So in the past, when issues like this have come up, there have been groups that have come together to make sure that information is getting out to the public. And, I'm communicating with my networks, and people just generally, even though we're doing all the things we usually do, they're just generally not aware that this is happening. And I think the impact that's going to happen in the community will be substantial. So I'm just wondering if there is like a network of, I think it would be good to connect with the churches and Rotary groups, the community councils, maybe some partners that aren't routinely receiving our emails, to make sure that the information as seen on the street, as verifiable, is making it to those groups. Because I hear discussion. I heard the mayor reference that he thought that 10 people a day could be placed in housing. He said that on Tuesday at the assembly meeting. And I just think that inaccurate information is potentially going to harm the efforts to address the needs of the people. And then the second thing I just wanted to say is, the contracts for paramedics at the Sullivan Arena were put in place because of the number of people who had medical crisis in that facility. And now those folks are going to be on the street. And I just feel that outreach is going to be so incredibly important to save lives over the course of however long this will be. And just wanted to hear if you have thoughts about that as well, or how we can help organize that.
Thanks, Nancy. So I think on the communication points, I think we need to figure out as a group how we want to communicate as a group around the challenges of increased individuals experiencing unsheltered homelessness, where that we want to kind of generate that initial communication from, and then the distribution. The coalition has a great distribution list, and we can certainly expand it to include community councils or other, I guess, non-traditional groups to ensure everyone's getting the same information. I feel like that's the easy part. It's the content of the communication. I can tell you right now, as the grantee for outreach coordination, we've been very specific in our communication around, we don't know where to send folks who are experiencing unsheltered homelessness, whether there's a camp abatement noticed or not, because we don't know of any low barrier shelter with capacity. We are offering and talking to folks about the capacity we are aware of in a couple of programs with requirements, so higher barrier. And we have asked the community to assist us in meeting this challenge around unsheltered homelessness in extremely hot and dry conditions. And we're doing that in a couple of ways. We're doing a hot weather items drive and coordinating with partners so that we have additional resources to offer those during outreach. We've also partnered with the restaurant program to stand up, and we'll be publishing the details of this hopefully by the end of the day, twice weekly lunches on Tuesdays and Thursdays as a kind of an access point, frankly, like when we don't have the hubs, so that folks can come out, get a good meal, get hygiene kits, get hot weather kits, hopefully have access to some power to charge ankle monitors. That's providing a very significant challenge for a number of people experiencing unsheltered homelessness. And hopefully we can coordinate in case management, and really just making sure we're getting the information out into the public that we're trying to do these things, but we, as a system, at least on the outreach side, that's the capacity right now. And that without additional resources and investment, we're going to have a really hard time adding in robust outreach for families, which we haven't had to stand up before, and just trying to meet the needs of those who are experiencing unsheltered homelessness. So that's kind of been our talking points. Happy to start with those and get all of the feedback and stuff, and we can try to get them out. Or if there's another way to try to convene and do that, we're all ears and ready to collaborate and take the HPRS's lead. Hi, Rob.
Hi, Meg. I just wanted to add to that. I know that there is no answer. At least obvious answer today, but I do want to speak on behalf of all the work we've done throughout the pandemic and before regarding outreach and the severe damage being done to outreach efforts right now. And frankly, I am concerned about attrition with our staff doing outreach across the city. And I really don't know. I just want the group to know that when I've gone out to the camps with our team, I'm not clear how we will transition through this period where we're having some aggressive abatements while turning down the Sullivan Arena. I don't know how we can transition unsheltered folks once something else stands up in this town. It's going to be a very difficult sell. I just need to state that it is. I've used the term last night in a meeting. It is very grim right now. And I really don't know what to tell somebody when they're being abated. I have no idea. I can't tell my staff what I think they should say. I don't know what we can do. But it is incredibly demoralizing right now.
Thanks for that, Rob. Yes, I think you captured the sentiment pretty clearly. I try to use the word dire. Demoralizing is another great term. This is why we're surveying the system to see if we find any glimmers of capacity, but we really don't have it. And I really appreciate your point about where will this leave us when new capacity comes on and the willingness to access that capacity. So thank you for that. And thank you to the Rural CAP team for their continued outreach efforts that have been very thoughtful and just very person-centered in these camps that have been noticed for abatement. I know it's really challenging to be in those environments where you don't have answers for folks who are looking for answers and are under the threat of having to be moved in very short order. Aurora.
Hi. It just occurred to me, I haven't seen one of the actual notices myself, pardon my ignorance. So maybe it says this, but who's actually going to be doing the abatement? Because if they sit those out on the 14th, right? It's been 10 days as of tomorrow. So is there a team put together that's going to be doing this? Or is it like, are they just trying to, scare people? My question is like, who's going to pull this off? Because it seems like there's not a lot of capacity anywhere. Not to put too fine a point on it, I hope that didn't sound rude. I just don't know who's going to do the work. Does anyone know?
I appreciate the question. I inquired kind of really about capacity where we could send folks, and I heard back from the Parks and Rec director, and they said that they will determine whether or not the abatement will go forward on Friday, depending on shelter capacity.
Okay.
Again, we don't see it in the system, but if the municipality is seeing it, we would hope they'll share that with us, especially as we coordinate outreach. In terms of the mechanics of the abatement, I would definitely turn to the expertise of Jessica or Rob, who have been more intimately involved with those situations on the ground.
I think too, while I'm unmuted, I just want to second Nancy's comment down here that we need to make sure reporters are accompanying outreach in the next couple of weeks. I will personally reach out to the folks that I know and try and get people connected however possible, but I think that's going to be really important too.
Thanks, Aurora. And yes, I can connect with you offline on some of the specifics of how the camp abatement happens, but I think the real challenge that we have with all camp abatements is that there's no set time for when the team is going to show up to do the abatement. So they could show up at 12:01 midnight, they could show up at 11:59 p.m. So that's always been a challenge. And being able to coordinate to make sure that there are outreach staff available during, not only just during the abatement itself, but throughout the period, to make sure we're supporting people and giving them the resources that they need to be able to connect to available shelter or available housing. That open communication is really important, and that has been really challenging with this particular abatement posting. I am very hopeful that the abatement doesn't happen. I know that it's very challenging when the capacity has to be available on the day of the abatement. So you end up with a little bit of this wait and see. You don't really know. You have this uncertainty of, am I going to be asked to leave or not? And if I am, where am I going to go?
Prince, I see your hand, but before we turn to you, Rob, did you have something you wanted to add on the abatement topic?
Yes, sorry, I did want to add a couple things. I want to be clear that traditionally over the years, our outreach staff have never been part of an abatement. It ruins the relationship if the outreach staff are seen as an entity or a member of the abatement team. So I think we want to be very careful how we do that. The other thing I want to also add, and I don't know, again, I literally have not slept days this week, nights this week over this. But I want to be really clear that I'm not proposing that camping in the city doesn't represent some real challenges and problems. But I want to highlight, if these abatements begin to occur, it's not like the unsheltered citizens of Anchorage are going to disappear. The problem is going to get worse. It's going to get more visible. And I don't know if there's an intention there that public opinion will be swayed more heavily against issues of homelessness. It is an easy target. I think it's an overly simplistic target. It doesn't address the real problems that we have as a community. But I do want to express, I had one incident last week where there was an individual in a camp with a gun looking for someone because they were certain they knew who had stolen something. So we're setting up a really quite volatile powder keg right now. I do not see the city ready for it. I repeat, people are going to get hurt. Yesterday we had someone die. Anything going down this road is not a solution.
Thanks, Rob. I appreciate your perspective and your comments. Anyone else want to discuss the topic of abatement before we move forward from there? I do want to elevate an issue that was brought to my attention. I mentioned it in my comments, but we're going to have a real challenge with those who aren't ankle monitors getting access to charging. The information I've received is that it takes an AC standard charger plug-in about an hour every day. And while we can try to mitigate those impacts through, the pop-ups for the outreach in the restaurant meals, that's only 2 out of 7 days. Just tossing and highlighting, elevating that issue as we continue to talk about abatement and outreach and unshelteredness. Anyone else on those general topics before we possibly turn to anything else? All right. Oh, sorry.
I was just gonna say, I don't know if Rebecca was raising her hand on that topic. I think you were raising it before, Rebecca, but not sure. You could put it in the chat.
No, thank you so much. Hi, folks. This is Rebecca Barker. I work at the Anchorage Public Library as a community resource coordinator. And I do want to underline what Rob's saying. I think that that's pretty much right on the money. And my specific question is actually more targeted toward like we've addressed these dire subjects and we know them to be too very, very serious, really too serious for the city to actually handle realistically, and we're gonna see a great cost in lives, I think. My question is, I've had the same conversation about 10 times this week already with different community partners, which is, what is the plan? And thank you so much to ACEH for the solid numbers that the plan is that people will discharge to the street. And the folks who are still on the street will remain there. I'm glad to have those solid numbers, but folks are asking, well, what do we do? Wasn't there going to be something coming online at the same time? I don't actually have answers to that. And it's true, I keep my head in the sand if I can. But what can we tell people? What can we as a community of providers communicate to our networks? Who do you advocate to make research to come online? Is it the mayor's office? Is it the assembly? Not our target, but to whom are we? Who's got the ability to move something forward right now? If we were protesting, to whom would we protest? So that's kind of the question that I've got when we've got all these heavy problems. Who do we take this to? Thank you so much.
It's a really great question, Rebecca. I would say One, we need to bring it to each other a little bit, just so we have open communication, dialogue, and problem solving around the issues as we become aware of them. I have to say, I've been really thankful for great feedback and communication. Looking at the last situation report produced by the health department in the decommissioning of the Sullivan Arena, it directs any requests for support for the homeless as a homelessness response, not a FEMA response, but a homelessness response, to go to the assembly. And the points of contact there have been Assembly Member Cameron Perez Verdia and Assembly Member Felix Rivera, who's been on vacation, as the two members who were participating in the facilitation. And Member Rivera is also the chair of the Housing and Homelessness Committee. So I just would elevate that that's where the directive has been from those situation reports. That's all I know. If others have ideas or thoughts, please share.
Meg, this is Nancy.
I think Prince had his hand up as well. If you'd like to go ahead, Prince, then we can move on, Nancy. Sorry about that.
Hello, thank you. This is both an inspiring discussion and also very challenging, because I'm new to this meeting. I represent the Revive Alaska Community Services, and I've been hoping for a kind of meeting like this as I watch the whole process going down, because just like Rob is expressing, for many of us on this line now, we have a level of compassion for those who are homeless, and you begin to wonder, they're already facing a whole lot of issues and uncertainty, insecurity, etc. Different levels of challenges. And now we're not only going to close down Sullivan Arena for obvious reasons, but we don't really have a plan for them. There is no place to go. So I've been thinking about it. I was there last week when the open house thing. I was like wondering, okay, if this shutdown happens, what the state of mind of somebody who's in that position. So that's really a very big issue, and I think we should be focused on that. Just like Nick said earlier, I don't think bringing cops there and all that would be the better option.
Thank you, Prince. Thanks for joining us. We really appreciate that, and for participating today. I hope you'll continue to join us as we work through these issues and beyond. Nancy, go ahead.
I think we can use some of the past actions to guide what we do. When the state vetoed all the homelessness funds in 2019, there was a concerted effort to bring this to the attention of not the local, not just the assembly, which I do agree with that, but the municipality and the state health department have shared jurisdiction for health and safety of people within this community. And it really is the responsibility of local government to help prevent life-threatening situations. And I think that the attention needs to get drawn to state legislators, the governor's office, and most definitely the mayor's office, as the municipality has health powers for our jurisdiction. And so this is not just call your local assembly member. This is larger than all of it. And I think that effort where we organized materials, we had people contacting their legislators, we helped people find who those legislators are if they don't know. We provided that information to the people being impacted themselves and asked them to call and to make, to ask them, where should I go? And I think, generally that should be the question, where should I go to get help within the municipality of Anchorage?
Thanks, Nancy. And I think we can, as the coalition, catalyze around hopefully an informational piece to that. And I'm actually putting in the chat, if you want to weigh in on any kind of a one pager we can use to catalyze additional voices to elevate the issues to the stakeholders that Nancy has identified. I'm going to ask that you put your email in the chat. I don't want you to do something that I'm not going to send it out to everyone, but if you really do want to have input into some kind of a comms document that's strategic to put out to additional stakeholders, let me know, because I welcome the participation and really want it. And I'm going to ask that you email me, because I'm just going to collate all of those and create a small email list. And with that, Kelly, please go.
Yeah, hi, thanks guys. I hope I'm actually unmuted. Just wanted to real briefly point out, I didn't catch where on the SITREP the municipality's response was through Tyler was directing folks regarding homelessness to the assembly, and not getting in the way of that. I definitely would recommend if there are specific concerns regarding the COVID-19 response and the Sullivan, either sending it directly to Tyler, and if I can work out how to spell his last name, I'll throw his email in there. But then also we have a email box that's shared, which is the AHD Mass Care Branch, which unfortunately is a long email address because it's AHD Mass Care Branch at anchorajk.gov. But I'll throw that in there. Several people look at that, and those individuals are currently engaged on the response. Right now, we have people that are driving buses and helping with some outreach efforts for us this afternoon. However, people do look at that. People would forward that if it's not seen directly by the Deputy Incident Commander, Jason. So definitely any specific concerns regarding the response, we want to hear them. We want to get them. The more specific they are, hopefully the better we can provide an answer and come to a better solution. If also you're not getting the SITREP, for those that are, feel free to share it as appropriate. And if you're not, you can also send me an email or that same email, and I'll try to put them in the chat there. But if you're not getting it and you would like it for you personally or your organization, we definitely want to make sure it's well communicated to everybody what we're doing and what we're going to try to do moving forward. And there's some delineation between the response, obviously, and homelessness in general that the municipality is taking a greater interest in. But that's what I had to say. Thank you.
Thanks, Kelly. Can I actually ask you a follow-up question just so we bring our concerns or our issues to the right place? Is what is the COVID-19 response right now with regard to mass care? We know the one facility is winding down. Is there still going to be a mass care posture? Like we don't have much insight into what's mass care or a COVID-19 response versus moving into a homelessness services response posture.
Sure, and I definitely appreciate that. So we have two branches, the mass care branch, and we still have medical countermeasures branch. And real briefly, medical countermeasures right now is a lot of the, hey, my facility has a question about what is provided, whether it's vaccines or testing. We still try to we take in the information from the state and communicate that out. Mass care has been the facilities that have been funded through these purposes. So it's going to continue to be the Aviator Hotel is still a mass care facility on the COVID-19 response. It'll be doing that for at least the next 90 days. Obviously, the Sullivan Arena closing at the end of this month has been a part of that as a congregate shelter. Obviously, the Aviator is non-congregate. And then part of the Aviator is also being used for a long-term solution kind of piece. And that's where we're moving out of the COVID-19 response and into, everyday homelessness activity or care or services. But we have different personnel that are assisting both the director of the health department and his deputy incident commander. And we might be able to make our org chart for the response is much smaller, obviously, than it used to be. So making it available might not be super helpful to anybody because it's only a couple names at this point.
Okay, thanks for that, Kelly. I'm just going to summarize back to make sure I heard correctly, is that mass care is a portion of the emergency response that is winding down, both with the actual closure of the Sullivan and the Aviator changing into a homelessness services response come beginning of July. I put a time on there, but I think that's my understanding. And then any COVID related issues we might be having around homelessness. So maybe access to testing, hygiene around COVID, and that kind of PPE. Would that still be an emergency type response, or is that something more in the other lane?
Yeah, it's more that other lane. I mean, the Anchorage Health Department normally, so my day job now is emergency preparedness. And so our community health nurses normally before COVID would go around to different parts of the city as needed. They would engage in pre-COVID vaccine clinics. They would engage in STI, STD screenings, TB screenings, that sort of thing. So everything that we've learned and gained through COVID will just be kind of added on to that. And it's, currently as they go and do their outreach events, it's just a part of that. So when they're going to another shelter or a shelter that's possibly funded or operated through the municipality, that'll just work its way into normal everyday business. But as it has been, it's been separate at these facilities just because they were set up and funded solely through response dollars.
Got it. Thank you for that clarification. And I went back and reviewed the last two sit reps, and the assembly direction was in sit rep 2 and not in sit rep 3. So if there is additional direction that could be provided by the municipality where to make sure these requests for assistance to fill the gaps in the homeless prevention response system in this challenging time, we're all ears because we have ideas, we're trying to meet the need, but we're just stretched too thin to take it on completely in the private sector. But I want to say thank you for being here and providing that information today. It is helpful.
Yeah, we do have Stanley Wright is the program manager for community safety and development. Andy Nestor is the program manager for the Housing and Homeless Services program here within the health department. So those two programs, those two individuals that a lot of everyone on this call probably already knows, they're engaged in much of that day-to-day business that will help toward these goals. And hopefully pretty soon, those of us that have been involved in the COVID response will move more into our day jobs and just supporting coronavirus needs as an unfortunately endemic day-to-day thing that the health department will just take care of.
Great, thank you. Thanks for those contacts. I'm going to turn now back to Prince.
Yeah, sorry guys, I was disconnected. Yeah, my comment and question was on what to do with all the clients at the Sullivan Arena right now who will be experiencing emotional crisis. So I think there should be a plan in place for more counseling, more resource officers to even start now to start talking to them, because many of them are going to experience crisis. It's not just moving out of shelter, but it's going to be too traumatic for many of them. And then number 2 is our organization, Revive Alaska. We have 2 buses that are handicap equipped. I'm directing this to David and the kind of facility they have in case any of them needs like handicap transportation or anything. And if you contact us, we can provide those buses to move some of the clients who might need handicap transportation. Then the other one, I think it was Nancy that mentioned something about reaching out to churches and all that. I happen to be in that cycle also. I think so far there has been some kind of outreach to churches, but there's a little apprehension, I think, based on past experiences, because churches used to really be the ones doing this every winter. There's kind of group of churches that were kind of always the go-to places every winter before COVID, to take in. But I don't know what broke down, whether it's some city kind of rules or ordinances or things like that. But it's something to really check into. It's not that the facilities are not there anymore, but it's just like there might be some experiences they've had in the past that's making them a little apprehensive. But I think if we approach the churches more, mostly those of them that used to do it in the past, they will still be able to help now. So those are the things I had in mind. Thank you.
Thank you. So thank you. This is why we have these meetings, for that offer of potential transportation. Dave Rittenberg gave you a thumbs up in case you couldn't see it. And then on the family shelter issue, we do convene a work group. And so I'll make sure our staff who's convening that work group, which involves a lot of faith leadership in the community, connects with you so you can be a part of that conversation and see how they're strategizing around that. So again, thank you for participating and raising those issues. I see Nancy's hand, and then I know we're noticed for a little while, but I know it's a busy time. So I'm just going to do, after Nancy's comment or question, going to do a time check and see if there's much more, or try to give you back a little bit of time. Nancy, go ahead.
I put it in the chat, but I did just want to state it in the meeting, and it's a little bit pointed, Kelly, toward you, but I just wonder, what is the administration's response that standing down the mass care facilities? I understand that EOCs have their methodology for operations and that there's ways that things are stood down, but it's hard to believe that there's been no connection to community planning about what the response will be for hundreds of people being released onto the street. And what is the administration or AHD's response to that?
Well, so I guess briefly, I can't give you a response for the administration. I wouldn't want to speak for anybody else, and really shouldn't speak for AHD as a whole. There are underway the operations in place. There's 121 people listed on the dashboard that were staying at the Sullivan last night. The goal is to get that down to 0 people as it closes. So we're not putting hundreds of people on the street out of the Sullivan. We understand that the inability to place people and really the inability to find locations for these individuals does hamper these efforts. These are the same problems felt by our organization as with all of yours. And so we are trying to work really hard. We're working with the facilities. That's where we did get the rooms at the Aviator that are separate from the ones that were being used for the response. It's a difficult time. We're working really hard to make sure that no one is put on the street. We understand that it's an inevitability. Some people are getting frustrated and going, well, then I'm going to leave, and they walk out. We're trying not to let that happen. We're trying to get as much information from these individuals. We're trying to connect them with your organizations so that they can move into an appropriate and safe location that they can be sheltered. So our position is that we don't want to let people end up on the street, and whatever we have to do to accomplish that, short of leaving the Sullivan open, which is just it's not a great facility for these needs, and we're hoping to get other facilities that are more appropriate on board.
And this is Nancy, I don't want to discount that work. I think there's tremendous work going forward to have those facilities in place ultimately. My read is it won't be until September or November that the full capacity matches what's available. And the reference of the Aviator, we're monitoring all of these placements daily, and there are not the number of placements that you just referenced. So there are definitely people going to be discharged to the street as a result of closure of mass shelter. And it's just stunning to me. I'm not that familiar with EOCs, but it's stunning to me that this transition can be so disjointed from actual assessment of capacity in the community.
So I want to take this as an opportunity to highlight, we do the system capacity updates, and we're updating them every other day. Kelly, I'm not sure if you're receiving them. I'm going to add you to that distribution and that request for updates list, and you can distribute it within AHD as appropriate. But if you all are aware of system capacity, we are not. Let's close the information gap that might be occurring, because I think that is where we're most challenged right now. Is we need to know where to tell people they can go if they're unsheltered, as well as we continue to work in cooperation to get folks who are currently at the Sullivan to someplace safe. Where is that capacity? Because again, we're in communication, so let's close the communication gap, and I'll make sure you're added to that list. We do that almost every other day, Monday, Wednesday, Friday, usually, with the weekend having that lag. I do think that there is still this strategic point that we all need to come together around, which is, what do we do when we do have increased numbers? We already have increased numbers of people experiencing unsheltered homelessness in our community. What can we do? I think, as far as I understand, the HPRS and providers are doing what they can and how they can with the resources they have. If we have additional strategic ideas, I think we need to put those together and make an ask if they need funding, if we need to better coordinate. That's kind of where I'm at with it, through the outreach coordination piece. And we are 1 minute to closing, so you're not going to get back any time. I apologize, but I'm going to let Jessica close us out with, first, my thanks to you all for spending this, I know, critical time with us. I've really enjoyed the discussion, and I thought it was very helpful. Jessica.
Thanks, Meg. And I just want to echo that. Thank you, everyone, for coming. Thank you for the conversation. Thank you for all of the offers that we had today. This is what is so important about our community and about our homeless prevention response system. For people who are looking for something that they can do right now, on the ACH website, as Meg mentioned earlier in the meeting, there is a list of items that we are opening donations to, so that we can ensure that people who are experiencing unsheltered homelessness right now have the resources that they need to be able to be safe and healthy, especially as we are having the hottest summer on record so far. So ensuring that people have hats and sunscreen and bug spray to be able to stay safe while they're unsheltered and experiencing homelessness is really important. So again, thank you everyone for coming. Check out the website for more information and a list of those items and how you can donate and support.